The oral glucose tolerance test is a diagnostic tool used primarily to evaluate how the body metabolizes glucose. It is especially useful for diagnosing diabetes mellitus, gestational diabetes screening, to evaluate hypoglycemia and monitoring of post-gastric surgery states to assess reactive hypoglycemia. When preparing for OGTT, the patient should consume a normal diet with adequate carbohydrates of about 150 to 200 grams per day for at least 3 days prior to the test. The patient fasts overnight for 8 to 14 hours before the test. Only water is allowed. Avoid medications affecting glucose metabolism unless absolutely necessary. Ensure regular physical activity before the test to avoid confounding results. When performing OGTT, the first step is a baseline measurement. A fasting blood sample is drawn to determine the fasting plasma glucose level. The next step is glucose load. The patient consumes a glucose solution, typically 75 grams of anhydrous glucose dissolved in water for adults or 1.75 grams per kilogram for children, up to a maximum of 75 grams. Blood samples are collected at regular intervals, commonly at 30, 60, 90, and 120 minutes to measure plasma glucose levels. For a 75 grams OGTT, the diagnostic values are as follows. For non-pregnant adults, normal fasting plasma glucose is less than 5.6 millimoles per liter. Impaired fasting glucose is 5.6 to 6.9 millimoles per liter. For diabetes, fasting plasma glucose is more than or equal to 7.0 millimoles per liter. For 2-hour plasma glucose test, the normal level is less than 7.8 millimoles per liter. Impaired glucose tolerance is 7.8 to 11.0 millimoles per liter. For diabetes, 2-hour plasma glucose test is more than or equal to 11.1 millimoles per liter. For OGTT in pregnant women, fasting plasma glucose is greater than or equal to 5.1 millimoles per liter. 1-hour glucose is greater than or equal to 10.0 millimoles per liter. 2 hours glucose is greater than or equal to 8.5 millimoles per liter. The advantage of OGTT is that it's sensitive for detecting early glucose intolerance, and it is the gold standard for gestational diabetes diagnosis. The limitation of OGTT is that it may be time-intensive, about 2 to 3 hours. It requires fasting and multiple blood draws, and may be influenced by stress, illness, or non-compliance with preparation guidelines. And that's all for this video. If you find this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.